Hey, good evening, everybody. Welcome to another Facebook Live chat with the Innovative Dad. Tonight's topic, we're going to be talking about anxiety, which is one of those things that crops up for all of us. It's one of the most common experiences for children and adults. And for the most part, it's completely normal. It's an adaptive reaction. It's connected to our fight or flight response that we have. That's a base part of the way that our brain works. And anxiety produces worry, which is the fear that future events are going to have a negative outcome. And anxious kids are more likely than their peers to see smaller things as being more threatening. And we know that large amounts of anxiety can be really problematic. So let's talk a little bit about how what specifically anxiety is, what some of the signs are, and then just touch on briefly some anxiety disorders. And this is when anxiety is present beyond a useful state. Some of the potential causes, and then some interventions, some things that you can do at home to make sure that if your kid is dealing with some anxiety, that you're there and available to be helpful and to support them through that. So depending upon the age, anxiety is going to present differently, and I want to be very, very clear to you that anxiety is a normal reaction to stressful situations. Having some anxiety is okay. Having a lot is when we start to talk about it from a clinical level. So for young children, we first really start to see anxiety appearing around 7 to 8 months is when you're seeing that classic stranger anxiety, when an infant is going to become distressed in front of strangers. And then it progresses as they age to about a year to a year and 3 months, about 15 months, where toddlers are starting to show that separation anxiety. When their parents are not nearby. You may remember that if you've got young kids, is the phase where the child will not let go of your leg. Both of these reactions, both the stranger anxiety and the separation anxiety, are completely typical and appropriate, and it says that childhood development is happening the way that we want it to be happening. And anxiety at this age is associated with strangers, new situations, animals, the dark, loud noises, injury, falling, those kinds of things. As we move into school age, up until about age 8 or so, many causes of anxiety are continue from preschool with a specific focus on identifiable events. As kids get a little bit older, sources of anxiety are going to become more abstract as they're able to deal with more abstract thoughts. So it could be around friends, it could be the future, a change at home, social acceptance, any of those things. And when you start to deal with adolescents, they become worried about things like academic performance, sexual concerns as they're developing their sexual identity, religious and moral issues. And for the vast majority of kids, they're able to cope with these using their natural resilience. And severe or chronic anxiety is not really common at that point. Now, there are a variety of number of signs of anxiety, and not every kid is going to show those same signs. And the big thing to pay attention to between an anxious and a non-anxious child when we're concerned about the anxiety is that the level of anxiety is excessive or atypical for where they are developmentally in terms of what their age is. That anxiety is present in an inappropriate or excessive manner for that situation, and that it's persistent for several weeks or months. And think about it this way. There is nothing wrong with a child being very anxious about going off a 3-meter board into the swimming pool. I myself, that was something that was always a trigger for me. I needed to, every year I needed to pass that for the band test at the swimming club, and I had to be pushed off by the lifeguards. Being anxious around something like that is totally fine. If it extends beyond that is when we become concerned. So in terms of some signs of anxiety, things to be looking for and paying attention to, 3 main categories to think about: thinking and learning, behavioral, and physical. So we're talking about thinking and learning. That could be we could be seeing anxiety presenting as concentration problems, attention issues, Worry, problem-solving difficulties, or memory problems. When we look at things from a behavioral basis, we could be concerned about restlessness, about some task avoidance, not wanting to go and do things, or engage in certain behaviors, irritability. A sense of perfectionism is also a potential sign of anxiety. Failing to complete tasks, fidgeting, rapid speech can be a sign of anxiety, withdrawal, lack of participation, and then seeking out easy tasks as opposed to trying to do hard things. On the physical end of things, there is always the classic butterflies in the stomach, which we've all had. And again, this is if it's excessive, if it's not appropriate for that situation. Skin can become flushed. You can have somatic reactions to anxiety, headaches, sleeping problems, a rapid heart rate, again, something that we've all felt, perspiration, muscle tension, nausea are all possible signs of anxiety and things to be watching for if you feel like you have a kid that is moving in that direction. And again, the metric that we're using is that it's excessive or atypical for their age. So there's nothing wrong with a 15-month-old freaking out over you leaving them. We're more concerned about that level of separation anxiety when we're dealing with an older child. And that's not as appropriate. And that when we start talking about atypical development, again, if it's causing persistent problems, and anxiety disorders that exist, they impair social, personal, or academic functioning. And from a frequency standpoint, they could occur in from 3% up to 20% of all children and adolescents. Generally for younger kids, infants and preschool children, anxiety disorders are much, much less frequent, and we start to see them more often in early childhood and in adulthood. And then, from a gender perspective, it is roughly the same between boys and girls during their school years. And as we move into adolescence, we see girls as presenting with 2 to 3 more times likely of a chance of having an anxiety disorder. For example, if there's a 10% frequency rate and you've got 30 kids in the class, 3 of them could have an anxiety disorder, and most likely 2 of them would be girls. All right, some examples of anxiety disorders. There's separation anxiety disorder, which is the only anxiety disorder that is specific to children, and this is taking that separation anxiety that we talk about for toddlers to an extreme, and it's associated with fears about leaving familiar people, usually the parents. The separation anxiety sometimes will create a pattern that we refer to as school phobia or school refusal, which is a little bit more accurate. As a reaction of not wanting to separate from parents. Then there's the generalized anxiety disorder, which is more related to just having pervasive and high levels of anxiety across different situations with no apparent trigger to it, as opposed to the separation anxiety, which has a clear trigger. This is having a tendency to worry about relatively minor things at a very high level. You might describe a kid with this as being very, very high-strung and very concerned about doing things well, having some perfectionist tendencies, perhaps. A child with a generalized anxiety disorder is going to be in a high state of arousal and appear to be very stressed. And it tends to require professional intervention to help kids because this is often chronic. Post-traumatic stress disorder is also considered to be an anxiety disorder, and it's the distress resulting from a traumatic situation. Children, unfortunately, are exposed to violent crime, auto accidents, home fires, a natural disaster, violence in the home, physical or sexual abuse, or even having a serious illness or injury. And these can all be things that will trigger PTSD. It's not just something that you get when you come back from being in combat. We see the impact of trauma on a regular basis in young children at my office and the impact that can have in their behavior. Symptoms of PTSD include things like emotional numbing, detachment from others, angry outbursts, flashbacks, concentration problems. They may be avoiding people. They may have sleep difficulties. They may also be reliving the experience by going through those stressful memories again. And then the last major area of anxiety disorders that we deal with in kids is social phobia. And this is, children that have an excessive fear or anxiety about being in a particular social situation, and a fear that that they're going to be evaluated by others. This is sort of a taking the idea that everybody is staring at me and bringing it to a much larger level. You might see it in a really young child as some shyness and social discomfort. It tends to come on gradually without any specific triggering event. And most likely, we see it really clearly in adolescence or early adulthood. So from a cause perspective, what the heck, why do anxiety disorders exist? So a lot of the research has been around genetic and environmental causes. We believe there's about roughly a 30% genetic contribution to anxiety disorders. That it is that a general tendency toward anxiety is transmitted rather than a predisposition for a specific anxiety disorder. From a biological perspective, temperament is something that also could impact it, and that's a relatively stable personality trait when we're looking at kids. Anxious kids tend to be a little bit more inhibited, more cautious, more tentative temperament that then would predispose them for an anxiety disorder. Looking at some of the brain imaging research that's been done, anxious kids may have some differences in their brain in terms of things that affect their attention, concentration, and memory. And then there's some family factors in terms of just that nature versus nurture, and that nurture component can be around from parents who are overprotective of their children or are modeling anxious behavior. Or also just preventing exposure to stressful situations. And you may think, if you can recall back to a couple of Facebook Lives ago where I was talking about parenting style, so that bulldozer parent who was just knocking all the barriers out of the way has the potential of creating some anxiety in their kids because they're never getting exposed to those stressful situations. Looking at the school end of things in terms of impact. Kids that are struggling with anxiety are going to have difficulties in school. They're going to be that tendency to be inattentive or perfectionist or forgetful or unwilling to participate in things because they're embarrassed about failure or concerned about failure is going to impact their ability to perform in tasks in school. If they're seeking out easy tasks versus difficult tasks, they're not going to, we want kids to learn from failure, and that's just not going to happen. And if they're withdrawing, they could be perceived as unmotivated, as lazy, or uninterested in school. And it's not that that's a characteristic of these kids, but it's how they present, even though they may very well want to feel and be motivated to be engaged in school, but they're just not able to do it because of the anxiety. Kids that are anxious on a social sense of things, again, we're going to withdraw socially, which creates issues with fitting in and sustaining friendships because you're worried about what are they thinking about me, and these fears are becoming sort of a vicious cycle. And by avoiding and worrying, you're getting some short-term solutions, but they're not really helping with the situation. Okay. So interventions, what we all want to hear about. Like what can we do to help solve this problem? So the first thing is you're always going to want to gather more information if you're concerned that your child may be anxious. So you want to know how typical is this for their age. Is it situation specific or is it pervasive across multiple situations? Did anything happen recently in the child's life that would potentially trigger an anxious event, a change in the family structure, changes at school, exposure to something new and different that may have frightened them? And then what kind of impact is it having on them personally, socially, in terms of their academic performance? You're going to think about what has been tried to help the situation and what worked and then what didn't work. And having these information available to us is something that is really helpful in terms of looking at it from a diagnostic perspective. And again, if this is something that is really causing a problem, I strongly encourage you to go out and seek professional help, talk with your pediatrician, reach out to your school counselor, your school psychologist at the school, get a referral to a mental health professional to help you deal with these situations. So, thinking about home and what we can do to help kids, or even if the anxiety is not at a clinical level, but it's still something that's impacting them. So it helps to be consistent in terms of how you handle problems and how you administer discipline. That lack of consistency in doing that can build anxiety because there's unpredictability. You need to be patient and be prepared to listen. I talked a little bit about this 2 weeks ago when we were talking about emotional coaching. You're really going to have to pull back from being overly critical, being disparaging, impatient, or even you're bringing your adult cynicism to bear. Remember, kids have a hard time understanding cynicism and sarcasm. They just don't have those language skills yet. Think about the goals that you have for your child and the expectations that you have. Are they reasonable for that? And make sure that in talking about your expectations that you're communicating that perfection is not required. Have some consistent routines, but those routines need to be flexible around homework, chores, and activities. Recognize that failure is part of growing up, and we all miss the mark. We all make mistakes, and no one is expected to do everything equally well. Provide praise and reinforce effort, even if success isn't expected. Spending some time practicing and rehearsing upcoming events. So if your child has to give a speech at school for an oral project that they're doing, make sure that they're having the opportunity to rehearse that at home. Help them with some simple strategies in terms of dealing with anxiety, such as organizing their materials and time, developing some scripts that they could say when anxiety is increasing, and learning how to relax under stressful conditions. And I'll post some scripts in the comments to this so that everybody can have access to them, things like Take 5 in terms of a breathing strategy. Don't treat feelings and questions and statements about feeling anxious as being something as silly or unimportant. We really want to validate the emotions, even as we're working to change the behavior. And remember, there's nothing rational about anxiety. Think about the fears that you have in your own life, either now as an adult or as a younger child, and recognizing that you're not going to be able to reason your way out of them. And even if you're able to do that as an adult, that you have those skills, remember that your kids are going to struggle with that. They don't have the cognitive abilities to do that. That's a real clear executive functioning skill that's just not present for them. Now, again, if simple solutions at home aren't working and you're finding that the anxiety is interfering with your child's quality of life and it is impacting the larger family, strongly encourage you to seek outside help. Again, pediatrician, your school mental health team, or an outside mental health professional. Get a referral from your insurance and get your child some support in this areas, because anxiety is a relatively common problem, and it is something that can cause some really significant issues. And the earlier that it is recognized and found to be present in a child, the sooner that we can get interventions in place and really start to reduce those negative impacts that they're having. So that's the rundown on anxiety this week. Join me next week. We'll be talking about growth mindset. What the heck is it, and how do I help my child develop it if it's something that they should have? Well, thank you for joining me tonight. Have a great evening, and happy parenting. Bye.